Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvira Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. Today's lecture, of course, you are knowing that fact. Now, I am taking the lecture for the students, but these lectures are not only for the students. Really, I am telling you, the person, the viewer, the subscriber, whoever is interested to know about Ayurveda, Ayurvedic treatment, Ayurvedic disease concept, Ayurvedic causes. So please don't miss the single lecture of Professor Deshpande, because Professor Deshpande is making the videos for everybody, for the medical students, medical doctors, medical professors, patients, and the common man. Because Dr. Deshpande is MD in Ayurvedic medicine, Kaya Chikitsa, and MD in Ayurvedic physiology, that is Kriya Sharir, with the very good team of the doctors. So you can definitely contact us for the paid online consultation on 922681060. The number is in the description. You can anytime WhatsApp me, but please don't try to call because I'm all the time busy. Okay, today's topic is very interesting because it's a very common nowadays, and that particular problem, according to Ayurveda, is a Shwasa Vyadhi. Shwasa Vyadhi can be compared with the bronchial asthma. So the person, maybe yourself, maybe your relatives, maybe your friend, whoever is suffering from bronchial asthma, please share this video to all these your patients, because we all are the well-wishers of these patients. Shwas is a breathlessness. Because of the problem in the lungs. फुफ्फुस का ये प्रॉब्लम है. आयुर्वेद के हिसाब से, according to Ayurveda, this is the disease of prana vah srotasa. Srotas are the channels in our body. Like the modern doctors, they call as a respiratory system, we call it as a prana vah srotasa. And there are also srotasa moolasthana. Moolasthana means controlling part. Either these sthanas can be the examination part, these sthanas can be the controlling parts, or these pranas sometimes can be the production of that particular element. But here, basically, Rudaya and Mahasrotasa are the Moolasthana of Pranava Srotas compared to the respiratory system. Now, Rudaya is not only heart, but it's a heart-lung machine, according to modern science. So you have to consider with the word Rudaya both the things, Puppusa as well as the heart, that is lungs and heart together. Yes, together. Because if you have the long-term bronchial asthma, that particular can affect to the heart circulation also. Heart chambers also get affected because of the lung disease. And that is called as a COPD, chronic obstructive pulmonary diseases, can give rise to the right ventricular failure. So there is a connection in between lungs and heart. So don't forget that. They are interlinked. Okay. So Shwasa Vyadhi. First, we will complete the basic thing, and then if the time permits, please check the video till the last, because I may tell you some interesting things at the last, like how we manage the Shwasa bronchial asthma according to Ayurveda, etc. Of course, there are many of my videos with relation to the bronchial asthma on my channel. Please check all the videos, because I have discussed a lot with the modern aspect and with the Ayurvedic aspect as well. Now, according to the Ayurvedic Samhita Compendia text, let us see what Ayurveda is saying. Shwasatvam Veg Urdhvatatvam. Madhav Nidan is one of the best textbooks for the diagnosis. Nidane Madhava Sreshtaha. Nidane Madhava Sreshtaha. Charakastu Chikitsite. Charak Grantha is very important for the understanding the principles how we should treat a particular disease. Okay, Shwasastu Bhastrika Adman Samavatordugamita. So direction is on the outside. Here, according to Ayurveda, there are two important Vata types. One is a Pranavayu and second is a Udanavayu. Pranagati, what prana is doing? Taking the oxygen from the universe into the body. So that is a pranavayu. Nishwasanna praveshakrat. Food and inspiration is giving the role to the pranavayu. And Udana Vayu, Udana is expiration. Uchvas is given to the Udana Vayu. So Udana is from inward to outward and Pranavayu is from outward to inward. Now in the Shwasa Vyadhi, there is a clash. There is a fighting in between Pranagati and Udanagati. It is get obstructed and that is become the Pratilomagati. The normal conduction is disturbed, inspiration and expiration. So all the definitions are from Madhava Nidan, and critics, the name of the critics, Madhukoshatika. We will see what is the meaning of it. Okay. This is a particular disease in which Uchvas in Ayurveda, that is expiration, is very rapid. Normally 14 per minute. RR, my name, RR Deshpande. RR, respiratory rate normal 14 per minute. When there is a breathlessness, when there is a tamakashwas, when there is a bronchial asthma, the rate becomes near about 40 to 50 per minute. And their accessory, these particular muscles, sternocleidomastoid, they also get more activated. Okay. So expiration rate is rapid. Then that is a sakashta, is difficult, dyspnea. Then that is atibadh, that is apnea. Always compare the two words. One is Ayurvedic word, another is a modern word. Then sashabd, a typical sound is there, abnormal sound, and rapid urdhvagati. That particular disease is called as a Shwas. So can you understand how many factors are there? First, respiratory rate is increased. Number 2, there is a sakashta. Number 3, there is a baddhata, obstruction is there. Sashabd, and that particular sound is called as wheezing sound. My dear friends, please write down this word, wheezing sound. Wheezing. Today again, I make my pardon because I don't know whether the viewers are hearing some sound, but I can hear there is some working going on, building construction and all this thing, and that sound is coming from outside to my room. But I am trying my level best to speak loudly because of to mask that particular sound, and my mic hopefully is not catching that sound. Anyway, the Shvasana Prakriya, respiration process, is like the furnace. I will mark for you so that you can easily understand. Okay. So this is a furnace of blacksmith. Furnace of blacksmith, Bastrika, Adman. Okay. When pressed, is like pumping. Air coming out with a big, that is called as a gushing or whooshing sound. Similarly, in our Shwasa Vyadhi, the same things is happen. Vayu emerges out with a loud noise during the expiration. That is modern science calling it as a wheezing sound. Please write down WHEEZING. Okay. So this is the Vikruti of Pranava Srotas. How you can see? Ati Srishta, difficult. Ati Baddha, obstructive type of the respiration is there. Let us move further. Now we are going to see the types of the Shwasa Vyadhi. Can you see? Types. Please write down, my dear friends. 1, 2, 3, 4, 5. For example, on the basis of the Samprapti, and the basis of symptoms, these are the types. 1, Mahashwasa. Please write down. Mahashwasa. Number 2, Urdhvashwasa. Second, Mahashwasa, Urdhvashwasa. 3, Chinnashwasa. Number 4, Tamakashwasa. Most important for you students, because in the oral, in the viva, in your hospital, the patients will be of Tamakashwasa. Remember my words. And Tamakashwasa is compared with the bronchial asthma. No other types. Only Shwas is not compared with the bronchial asthma. Tamakashwasa disease is compared with the bronchial asthma. Then there is also Kshudra Shwas. I repeat the 5 types: Mahashwasa, Urdhvashwasa, Chinnashwasa, Tamakashwasa, and Kshudra Shwas. Urdhva Gati of Vayu is common in all these particular types. Now we are going to see the Hetu. Okay, can you see the Hetu? That is the causes. And I am very surprised and I am very proud to tell you that these same causes are existing today also. Charak has written his text 5000 years BC. Whatever he has noted at that time Still, one or the other way, they are present. These causes are present also today. See, very interesting shlokas. Charak Chikitsasthan, chapter number 17. So naturally, my dear friends, it is not necessary when we are taking the class of Charak Uttarardha, this chapter, 17th chapter, only we will see the treatment at that time. Okay, because this is a repetition. Rajasa Dhumavatabhyam Shitasthanambu Sevanat Vyayamat Gamya Dharmadva Rukshan Vishamashanat Ama Pradoshat Anahat Raukshat Ati Apatarpanat Daurabalyan Marmano Vatat Dvanva Chudyat Yogataha. Okay, but don't take tension. Although I am reading the Sanskrit, it is not mandatory. It is not compulsory to write each and every shloka in the examination. It is not compulsory. But yes, you have to write down the meaning. अर्थ बताना चाहिए ना आपको, क्या अर्थ है इसका. तो ध्यान से सुनिए मेरे प्यारे दोस्तों, ये जो श्लोक है ना, इसका अर्थ मैं तो अभी बताने वाला हूं. फिर एक ध्यान से सुनिए कि all these causes are moreover related with the 2 or 3 things. One is with the ahar and second is with the vihar. So you write down always in any disease, try to differentiate ahara causes and the vihara causes. That is food causes and the lifestyle causes. Okay, but mainly also it is related with the external atmosphere and air pollution. Air pollution is the most important cause for this Shwas Vyadhi, for the Tamak Shwas Vyadhi. Tamak Shwas is also related with the allergy. Allergy of the food, allergy of the pollen grains, allergy of the scent, allergy of the dust, allergy of the fumes. Even the many people, I will tell you, don't even get this, the stick, scent stick, udbatti. In Marathi, we call it udbatti, like for worshipping. The fumes coming from this udbatti also cannot be tolerated by many people, and they get the breathlessness. They don't tolerate the scent. So they make the notification when they invite the people for the marriages and the ceremony. They write down that the host is having allergy for typical scent. So nobody is, or rather requested, don't make that means come with the scented any perfumes and all these things. So this is practical things that I am telling you. Okay, let us see what are the causes exactly. But here I will tell you only important things, whichever I have underlined, that only you remember. Don't go for each and everything. Okay, sorry. Okay, here I will mark you for you. Very important things. You write down first ahar. Come on, I will wait. Food causes one of the bad food that I am explaining which type of the food can cause problem with the tamakashwas, and also that particular ahar and vihar. Can you see vihar? Vihar is a lifestyle activity which is dosha prakopak. Basically, here are 2 doshas. Write down vata dosh and kapha dosh. Most important, vata dosh, kapha dosh. Please write down vata and kapha. I am saying the shloka of vata. Just listen. Don't take tension. Tatra ruksho lagushitaha kharasukshmaschalo nilaha. Tatra ruksho lagu shita. Write down. Please write down. Shita. Cold is very bad. Cold is very, very bad for tamakashvas. I will explain. Cold food, cold atmosphere, ice cream, air conditioning. Cold is bad. Shower with the cold water. Bad. Freeze, bad. Cold drinks, bad. Cold is a bad because vata is having cold, shita guna, and also kapha is having shita guna. So in vata and kapha, shita guna is a common. Please write down. In vata and kapha, shita or the cold property is common. Be quick, write out fast. Okay, then, so that is a dosha prakopak. And sthana vaigunya, this word is very important. Sthana vaigunya, lungs, puppusa is a sthana. Vaigunya is a less immunity. Our patient's lung is having the weak, W-E-A-K, bad immunity. And that is why he is suffering from bronchial asthma. So 2 things are important. One is a sthana vaigunya. Please write down this word, sthana vaigunya. lungs, immunity is bad. Why? Why, sir? Why? Because he is smoking all the time. Maybe he is living in the very damp, wet, crowded area, so no ventilation. He may be working, that patient, in the industry where, for example, asbestos industry, then glass working, where the dust is coming, and that is making his lung, the patient's lung, become weak. W-E-A-K. Weak means less immunity. Lung, less immunity. Lung, less immunity, and attack of Vata and Kapha. Bronchial asthma. So, in short, Dr. Deshpande has explained the samprapti. Okay. Ahar. Heavy. Sorry. Udad. Udad is a black gram. Black gram. Why, sir? Because many people, they have the allergy of proteins. Allergy of protein. They cannot tolerate the eggs. They cannot tolerate the ground nut. So this gram, maybe green gram, but green gram allergy is very less. Green gram allergy, mugachi dal, mung dal, allergy less. For tur dal, for urad dal, allergy is more. Right? Protein allergy is there. Okay. Then bread prepared from fermentation. Whenever there is a fermentation, when we eat idli, dosa, uttappa, dhokla, South Indian dishes, or we take the daily curd, then that fermented product makes a lot and lot secretions. Secretions in the nose, secretions in the throat, secretions in the bronchi, secretions in the trachea, secretions in the lungs, secretion, cough, cough. Dr. Deshpande is making action because you must remember, fermented products, curd bad, dhokla bad, uttappa bad. For bronchial asthma patient, these substances are not bad. Oh my God. Each and every food is good. But for these asthmatic patients, please, minimum 1-2 years, they should have some do and don't. परहेज रखना पड़ेगा, पथ्यापथ्य करना पड़ेगा. ठीक है, तो ये आपको सबको. Then rice and wheat, they are heavy to digest sometimes, because these patients also having the Agnimandya. Please write down. In Shwas, this is a Vyadhi of Pranavasrutas. But I am telling you very important and interesting thing. Are you hearing? Are you hearing? Okay. The Shwas is a disease of Pranava, but it starts from Annavasrutas. Oh my God. Disease of the lung, but according to Ayurveda, Ugamasthana, where it is starting? Amashaya. Yes, very interesting. Amashaya it's starting. Why, sir? Why? Kledaka kapha. Write down. Kledaka kapha problem. That Kledaka kapha gives the signals to the other sides, and Avalamba kapha also bad. Avalamba kapha is in the lung, in the heart, in the chest. But first problem is in the stomach. So asthmatic patient many times also having indigestion, loss of appetite, constipation. Yes, it is there. It is gas. So check their digestive system also, because the Vyadhi is of Pranavasrutas, but starts in the yes, Annavasrutas. Don't forget this. Don't forget. Okay. Then there is a idli, curd, buttermilk. All are the sour. Sour food is very bad. Excessive sweet, excessive sour, excessive salt. Salt is also hygroscopic. So lot of water, lot of secretion and obstruction. Srotorodha. Cough with expectoration. Cough with expectoration. Sputum. White, green, yellow. White, yellow, green. Color of the sputum. This is all things are happening in the lungs and bronchial tree and the trachea. Okay. So Jalaj and Anupamaus. Kafakar. Fish, for example. Lot of fish problem. Some people have the fish allergy. Some people get the pitta prakop, and also the more water in it there, and so obstruction is there. Then raw milk without boiling, that is also heavy to digest. Guru padarth, heavy to digest. Frozen food, shita padarth, from the freeze. Cold drinks, ati sevana, excessive eating, very very bad. Now we will go, I think next page is there. Yes, vishtambhi. What is vishtambhi? Which can cause the constipation, which can cause the obstruction, which can cause the gas. So here all the words are there. I will mark for you again because you can concentrate over there. Here, can you see now my cursor? Very clear now. Abhishandi. Very easy. This disease is understanding is very easy. Very, you will get good marks. Shwas vyadhi, bronchial asthma, tamaka shwas. That is more important. Atishit, I have already explained you. Causing the some, there are two types. Now this is new concept. This is new. Please write down. Are you writing? Yes. Practical purpose in our medical practice, when you will see bronchial asthma patients, please note my point. Bronchial asthma patient, some patients, they are little bit obese, lot of cough is coming, lot बड़ी मात्रा में आ जाता है कफ उसको, ठीक है ना. ओबेस भी हो सकता है, नॉर्मल बिल्ड भी हो सकता है. कफ निकलने वाला एक ब्रोंकियल अस्थमा का प्रकार होता है, सकफ बोलते हैं, सकफ श्वास. और दूसरा एक प्रकार हो सकता है, देखिए ध्यान से सुनिए मेरी बात. ऐसे भी कौन ब्रोंकियल अस्थमा वाले आपको पेशेंट दिखाई देंगे कि जो ओबेस नहीं है, वो रादर वो थीन है, बिल्कुल पतले पतले हैं, वेट लॉस है उनमें, और फिर भी उनको ब्रोंकियल अस्थमा है. तो ब्रोंकियल अस्थमा का हर व्यक्ति ऐसा ओबेज होने की जरूरत नहीं है. Not necessary that everybody will obese or overweight or having lot of cough. No. Some patient may not have absolute no cough. तो ऐसा कैसा हो सकता है? अरे हो सकता है, वही मैं कह रहा हूं ना आपको. तमक श्वास के दो प्रकार लिख लो, आप अभी लिख लो. एक में कफ निकलने वाले एक आदमी रहेंगे, और कुछ पेशेंट ऐसे रहेंगे जो बोलेंगे हमें सूखी खांसी आती है, कुछ निकलता नहीं सर, बलगम ही निकलता नहीं है, उससे ही ज्यादा तकलीफ होती है मेरे को सर, पूरा ड्राइनेस है यहाँ पर मेरे का. कोई नहीं सर, कफ बिल्कुल नहीं है, सिर्फ मेरे को, उनको बोलते हैं कि ब्रोंकोस्पैज्म उनमें ज्यादा होता है. सो जो स्रोतोरोध की बात मैं कर रहा हूं ना भैया, मेरे स्टूडेंट्स ध्यान से सुनिए. स्रोतोरोध की बात दो तरह के ये श्वास व्याधि में होती है, दो तरह की. एक स्रोतोरोध होता है ज्यादा कफ होने से, और दूसरा रुकावट आ सकती है जिसको इंग्लिश शब्द लिखिए आप कृपा करके, उसको ब्रोंकोस्पैज्म बोलते हैं. BRONCHO, ब्रोंको, और स्पैज्म SPASM. तो ये आपको देखना पड़ेगा तमक श्वास के पेशेंट्स में कि उसमें कौन सा संतर्पण का प्रॉब्लम है, ओवर न्यूट्रिशन का प्रॉब्लम है, या अपतर्कण का प्रॉब्लम है, उसमें कुछ मतलब कमी है शरीर में. देखिए ध्यान से सुनिए मैं क्या कह रहा हूं. एक तो होता है मार्गावरोधजन्य वात. अभी ये वर्ड भी मैं आपको लिखने के लिए विनंती करूंगा, मैं रुकने वाला हूं, क्योंकि एक बार ये पोर्शन नहीं कंप्लीट हुआ तो भी चलेगा, क्योंकि बेसिक कंसेप्ट आपके मन में, दिमाग में बहुत अच्छे होने चाहिए. ब्रोंकियल अस्थमा की बात चल रही है, तमक श्वास की बात भी चल रही है, और डॉक्टर देशपांडे दो प्रकार बता रहे हैं प्रैक्टिस में देखने वाले. एक तो होते हैं कि जिसमें कफ ज्यादा निकलता है, वो ऐसा खाना भी कुछ ज्यादा खाते हैं, ओबेस भी हो सकते हैं, है ना. और दूसरे लोग ऐसे होते हैं जो पतले होते हैं, उनमें कुछ कफ बिल्कुल निकलता नहीं, फिर भी सांस लगती है उनको. तो ये हो गया एक प्रकार. आयुर्वेद लिखता है पहले वाला, मार्गावरोधजन्य वात प्रकोप. 3 बार बोलूंगा मैं, आपको लिखना पड़ेगा. मार्गावरोध ऐसे चल रहा है ना, तो उधर ऑब्स्ट्रक्शन है. मार्गावरोधजन्य वात प्रकोप, मार्गावरोधजन्य वात प्रकोप. थोड़ा सा कॉम्प्लिकेटेड है भैया शब्द, ऑब्स्ट्रक्टिव पैथोलॉजी बोलते हैं इंग्लिश में. मार्गावरोधजन्य वात प्रकोप. और दूसरा मैं बताता, अभी दूसरा सूखा वाला ड्राई वाला, उधर भी वात प्रकोप है. धातु क्षयजन्य वात प्रकोप, कृपा करके लिखिए धातु क्षयजन्य, टीबी नहीं, टीबी नहीं, धातु क्षयजन्य वात प्रकोप। तो वात प्रकोप दोनों तरीके का यहां पर मिलता है श्वास व्याधि में। कभी कभार ज्यादा कफ से ऑब्स्ट्रक्शन है, कभी कभार ब्रोंकोस्पैज्म से ऑब्स्ट्रक्शन। समझ आ रही है बात? थोड़ी थोड़ी समझ में आ रही है? तो उसी हिसाब से आपको हिस्ट्री टेकिंग करनी पड़ेगी, उसके जो कारण है वो निकालने पड़ेंगे। व्हाट आर द कॉजेस, और धातु क्षयजन्य वात करो, कौन सी धातु का कमतरता है उधर, कौन सी डेफिशिएंसी है। हाँ, चाहे वो डिहाइड्रेटेड पेशेंट हो सकता है ना, पानी कम पी रहा है वो पेशेंट, वो पूछना पड़ेगा आप। ठीक है। दूसरा एक बोलेगा मेरे को एनीमिया है, पांडु व्याधि है, हीमोग्लोबिन कम है, उसमें मिल सकता है। किसी का वेट लॉस है, ऐसे पेशेंट मिल सकेंगे। मस्क मांस धातु का क्षय है ना। किसी में फैट नहीं रहेगा तो मेद क्षय हो गया। किसी की इम्यूनिटी या शुक्र धातु सेक्सुअल जो है ना एक्टिविटी वो ज्यादा रहेगी, शुक्र क्षय हो सकता है। तो ये सब कारण धातु क्षयजन्य वात प्रकोप में आ जाएंगे। हाँ, यहां पर लिखा है देखिए, अपतर्पण बोला है उसको, क्या बोला है? अपतर्पण। तो ये एक बात है कि ज्यादा गुरु खाना, और दूसरी बात है कि ज्यादा रुक्ष, कोई पानी नहीं अच्छी तरह से पीना, बेवरेजेस नहीं लेना, मिल्क नहीं लेना, कुछ भी नहीं लेना, है ना। ज्यादातर ऐसे पॉपकॉर्न पर रहना, वड़ा पाव पर रहना, रूखा सूखा खाना, कुछ दाल चावल चपाती ऐसा कुछ नहीं खाना। हाँ, कम लेना, कम खाना। पॉवर्टी हो सकती है, खाना उसको हजम नहीं हो सकता, कोई कोई कारण हो सकते हैं। आगे चलते हैं, बिहार को देखते हैं। एक्सपोज यूर टू द डस्ट फ्यूम्स वर्कर्स इन द डाई इंडस्ट्री। जो डाई है ना, पेंट वगैरह करते हैं ना, उधर उस इंडस्ट्री में काम करता है वो। वेरियस केमिकल फैक्ट्रीज, ग्लास फैक्ट्री, एक्सेसिव स्मोकिंग, एक्सपोजर टू द कोल्ड एंड डैम्प एनवायरमेंट, अति संक्रमण। इतने घूमते फिरते रहते हैं ना, तो उसके क्या हो जाता है, धातु क्षयजन्य वात प्रकोप हो जाता है। बहुत एक्सरसाइज करते हैं, भागदौड़ में लगा रहते हैं, तो उनको भी एक कभी ना कभी एक दिन श्वास व्याधि की बीमारी हो सकती है। अति शीत एटमॉस्फेयर, एयर कंडीशनड, ऑलवेज फैन इन द रूम, shower, cold shower, exposure to the excessive vat, whole life, 30 years, 20 years, they are moving with the bikes, boom, 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 boom. So naturally they get exposed to the lot of wind. So that is also the problem. The most important in Ayurveda is Vegavarudh. आपको पूछना चाहिए हिस्ट्री में। आप दमे वाला पेशेंट है तो ध्यान से सुनिए, आपको ये आदत हो सकती है कि आप यूरिन को जाना चाहते हैं, मतलब यूरिन आती है आप नहीं जाते, कुछ काम की वजह से टाल देते हैं आप। टट्टी को आती है आप नहीं जाते टट्टी को। आपको भूख लगती है दोपहर को, खाना आप नहीं लेते क्योंकि काम पर बिजी व्यस्त रहते हैं। पानी पीना चाहिए, प्यास लगती है आप पानी नहीं पीते। तो इसको आयुर्वेद ने कहा है कि वेगावरोध, जो नेचुरल इंस्टिंक्ट्स है वो हम दबा लेंगे तो उससे तकलीफ हो सकती है। ठीक है, ये सब कारण आपको प्रश्न परीक्षा में पूछना पड़ेगा हिस्ट्री टेकिंग। आगे चलते हैं धीरे धीरे करके, थोड़ा थोड़ा स्क्रीन ऊपर लेते हैं। ठीक है, ये देखिए कारण की बात चल रही है, यहाँ पर कारण की बात चल रही है मेरे प्यारे दोस्त। ये देखिए अभी मार्क कर देता, अगला वाला जो है ना ये मार्क कर देता। हेतु, हेतु कारण, कारण चर्चा कर रहे। देखिए दोष प्रकोप और स्थान वैगुण्य, ये तो दोनों चीजें मैंने पहले ही बता दिया आपको। ये देखिए ड्यू टू द आहार एंड विहारज हेतु, हेतु का मतलब कारण, कॉजेस, वात एंड कफ गेट प्रॉब्लमैटिक, उसको पैथोलॉजी हो जाती है। और स्थान वैगुण्य मतलब लंग्स खराब होने के कारण, इम्यूनिटी कम होने के कारण श्वास व्याधि की निर्मित हो जाती है। फॉलोइंग व्याधिज आर द कॉजेटिव फैक्टर्स फॉर श्वास व्याधि दौर्बल्य। मतलब पहले भी मैंने एक्सप्लेन किया है कि किसी में रस धातु की कमतरता हो सकती है, रक्त शुक्र ओज क्षय हो सकता है, कई लोगों को अलग अलग कुछ बीमारियां हो सकती हैं, डिफरेंट डिसीजेस बाय विच हिज इम्यूनिटी इज लो। फॉर एग्जांपल पांडु का मतलब एनीमिया, राजयक्ष्मा का मतलब ट्यूबरकुलोसिस, उरक्षत का मतलब है सिमिलर थिंग्स लाइक कैविटी इन द चेस्ट, रक्त पित्त, ब्लीडिंग डिसऑर्डर्स हो सकती है। देन मर्मोपघात, कई कबार क्या बोलते हैं हार्ट अटैक आ जा सकता है। ब्रेन अटैक का मतलब सेरेब्रोवैस्कुलर एक्सीडेंट्स बोलते हैं, पैरालिसिस का अटैक आ जा सकता है। और किडनी खराब हो सकती है, लीवर खराब हो सकता है। तो ये सब मर्मोपघात है। मर्म मतलब वाइटल ऑर्गन्स। ठीक है, रुद्रो शिर एंड वृक्क व्याधि, किडनी डिसीजेस, जीर्ण प्रतिशाय, क्रॉनिक साइनोसाइटिस, राइनाइटिस, देन कास, क्षयज कास, इनटेक ऑफ टॉक्सिन्स, इन्फेक्शंस बार बार होना, टॉक्सिन का मतलब बार बार इन्फेक्शंस होना, ये सब व्याधि हमारी लंग्स को बिगाड़ देती है, इम्यूनिटी कम करती है और श्वास व्याधि को स्थान वैगुण्य मिल जाता है। आगे चलेंगे और बात करेंगे संप्राप्ति की। ये देखिए मेरे प्यारे दोस्तों, वेरी इंपॉर्टेंट, संप्राप्ति इज वेरी इंपॉर्टेंट। संप्राप्ति एक लिख लीजिए कृपा करके, पैथोजेनेसिस, उसको क्या बोलेंगे हम, पैथोजेनेसिस, GENESIS, है ना, चय प्रकोप प्रसर स्थान संशय व्यक्त्यान भेद, मारुतः प्राणवाहिनी स्रोतांसी आविश्य कुप्यति, उरस्तः कफमुद्धूय हिक्का श्वासान करोति सा, चरक चिकित्सा स्थान चैप्टर 70। ये जो मारुत का मतलब है वात दोष, प्राणवाहिनी स्रोतांसी, उसकी तकलीफ, वो बिगड़ कहां जाता है, तो प्राणव स्रोतस में इट गेट डिस्टर्ब, एंड उरस्तः कफमुद्धूय, उरस स्थान में कफ का सिक्रीशन बढ़ जाएगा और हिक्का या श्वास जैसी बीमारियां पैदा हो जाएगी। यदा श्रोतांसी संवृद्ध मारुतः कफपूर्वकः, मारुत का मतलब वात दोष और कफ दोष का मतलब कफ दोष है, ठीक है। चलो आगे चलते हैं, अभी ज्यादातर सॉरी इंग्लिश ट्रांसलेशन देख लेंगे तो उसको आपको समझने में आसानी हो जाएगी, ठीक है। श्वास, एक देखिए ये जो लाइंस है ना, उसमें से एक दो शब्द भी आपको याद है, कौन सी भी आयुर्वेद की आप जब चर्चा करेंगे, लिखते जाएंगे एग्जामिनेशन में, तो कौन सा भी श्लोक आपको एक दो शब्द या एक दो लाइन भी याद है तो कृपा करके लिख दीजिए एग्जाम में। संदर्भ याद है तो संदर्भ, कम से कम चरक लिखो भैया, कम से कम चरक चिकित्सा स्थान लिखो भैया मेरे प्यारे दोस्तों, दो नहीं लिखते आप। अरे ये तो है ना रेफरेंस, और कहां से आएगा रेफरेंस, तो रेफरेंस तो लिख दो बिल्कुल, क्या तकलीफ नहीं उसमें, कोई कोई नहीं। एक बार एक आधा शिक्षक पूछेगा आपको, अरे आपको चैप्टर नंबर याद नहीं, नहीं सर मेरे को सिर्फ ये चरक चिकित्सा स्थान याद था, मेरे को चैप्टर, किसी को चैप्टर नंबर याद होगा सर 70 लिख दीजिए, ये आगे वाला जो है ना श्लोक नंबर, भूल जाओ उसको, भूल जाओ, ठीक है। तो ये देखिए किन स्टूडेंट को ऐसा याद होगा कि मारुता प्राणवाहिनी स्रोतांसी, अरे आप बहुत बढ़िया चीज है भैया, मारुता प्राणवाहिनी स्रोतांसी डैश डैश डैश, ट्रिक बता रहा हूं, ट्रिक परीक्षा की, डैश डैश लिखते जाइए, परीक्षक मानेगा कि ठीक है ये स्टूडेंट थोड़ा कोशिश तो कर रहा है, कोशिश इज वेरी इंपॉर्टेंट, आपका प्रयत्न दिखना चाहिए एग्जामिनेशन, ठीक है। प्रकुपित वायु एंटर्स द प्राण, नीचे वाली देखिए, यहां पर कर्सर लाता हूं मैं, प्राण वसु तो उसमें आ जाएगा, वेयर स्थान वैगुण्य इज ऑलरेडी देयर, योर लंग्स आर वीक, रिमूविंग द मृदु एंड स्निग्ध, उधर जो सॉफ्टनेस होता है ना वो निकल जाता है, और अवलंबक कफ भी, यहां पर ज्यादा अवलंबक कफ है उसको भी रुक्षता आ जाती है, ठीक है। इज डिस्ट्रॉयज द नेचुरल सॉफ्टनेस ऑफ द प्राणव स्रोतस लीडिंग टू द वात प्रकोप, रुक्षता बढ़ जाएगी, ठीक है। एंड दिस इन टर्न इंक्रीजेस द रोक्षता, काठिन्य ये बढ़ जाता है, ठीक है। आगे चलते हैं, ये देखिए अभी अभी पैथोजेनेसिस चल रहा है, कौन से कैसे कैसे उसमें प्रॉब्लम्स आ सकते हैं, ये देखिए संकोच गुण, कॉन्स्ट्रिक्शन हो जाता है, ब्रोंकोस्पैज्म यहां पर लिखा है देखिए, स्रोतस अकुंचन का मतलब होता है ब्रोंकोस्पैज्म, यहां पर आमा इज ऑल्सो फॉर्म ड्यू टू द कफ प्रकोप के हेतु, अग्निमांद्य इज देयर, मिथ्या आहार विहार, some are very important words. I'm sorry at this moment I cannot wait for each and everything, but you can make a screenshots or you can write down the small thing, agnimandya, mithya ahar vihar, okay. Then sama, kledak kaf become with ama, sama vayu, sama kapha, these words are very important, nirama vayu, nirama kapha, so samavastha is there in shwasa vyadhi, tamaka shwas, samavastha is there, okay. This causes samata to the avalambak kaf in pranavasotas, okay. Sthyan, it becomes sticky, the most important problem that the bronchial asthma patient, they cannot take out the sputum very easily, there is always a stickiness, bronchospasm plus stickiness, बिल्कुल बर्बादी हो जाती है, ठीक है। हम उपचार भी करते हैं अच्छी तरह से, स्नेहन स्वेदन करते हैं ना तो ये सब चला जाता है, स्नेहन स्वेदन करने से ब्रोंकोस्पैज्म गल चला जाता है, स्टिकीनेस चला जाता है, स्नेहन स्वेदन इज द मोस्ट इंपॉर्टेंट, ओके। Then here is always avarod, obstruction is there. Sankuchita srotasas are there. Okay, I am just remaining Sam avalamba kaf, two factors. Prakrit conduction of the pran and udan vayu gets disturbed, and urdhvagati of vayu upward. Shwas vikruti lakshanas are there. कौन सी लक्षण होती है वहां पर? रैपिड रेट होता है, सांस जल्दी चलता है 40-50 प्लस मिनट. देन सकष्ट डिस्निया बोलते हैं उसको, क्या बोलते हैं? डिस्निया. ओके, स शब्द व्हीजिंग साउंड्स आर देयर, रोंका आर देयर, रास आर देयर, वातज ध्वनि और कफज ध्वनि स्टेथोस्कोप के द्वारा देखेंगे हम. हाँ ठीक है. सशूल, समटाइम इतनी सांस लगती है, खांसियां आती है कि पेन, चेस्ट पेन होने लगता है. ठीक है, ऑब्स्ट्रक्टेड श्वास. Srotas avarod also leads the prakopa and pratiloma gati of vayu is started. Next, we will go further. So, in short, some important terms are here. I can tell you. See. First, can you see? This is very important. I will dictate. Udbhavasthan, beginning is Amashaya. Udbhavasthan, beginning Amashaya. Then Kledak Kaf, in Amashe, Kledak Kaf Dushti is there. Have you written? Udbhavasthan, clear? Second is three words here I have written. Adhishthan and Sancharasthan. Three words are important. Udbhavasthan, Adhishthan and Sancharasthan. Starts in the Amashe, digestive system. Then Adhishthan is a Urasthan, chest region. Pran, Udan and Avalamba Kaf, they get pathological. And Pupus also, of course. And Sancharasthan is total respiratory tract from the nose to the alveoli. So total tract is there. That is a Sancharasthan. We are discussing the Nidana Panchapanchak. So after Hetu, Nidana Purvarupa. Purvarupa is a warning signals. Danger, cautious, careful. So there is first the patient will have Agnimanka Lakshana, like Annadvesh, don't want to eat, Aruchi, no proper test. Then Anah is like a gas in the stomach, gas in the abdomen. That is like a depicting the Vaigunya in Pranavasrutas or the Shwas, which indicates that there may be some problem. Little difficulty in breathing. Then Kashtata, then Parshvashula, lung pain will be there, chest pain. Rutpida, at the chest region, in the chest, there will be like a constriction feeling. Feeling of choking is very important. So these are warning signals which are called as a Purva Rupa. Now we will go for, I'm sorry, Rupa. Just I will mark the separate step by step. Purva Rupa, then Rupa. We have covered Nidana, Purva Rupa and Rupa. So Shabda with sound, wheezing sound, wheezing. Sakashta, dyspnea, diva, S, P-N-O-E, dyspnea, rapid. So Shula, pain will be there. Shwasan, all these are the features of this Shwasa which are telling you that person is suffering from breathlessness or the dyspnea disease or the symptom. I can say the symptom. Now, Lakshana according to the types. First, here they have mentioned Kshudra Shwas. Ruksha Yasod Bhava Koshte Kshudro Vatodiren. This is very mild. This is Sadhya. Please write down. Kshudra Shwas is a Sadhya Vyadhi, curable. Because that is not a big thing. I will tell you what is happening. This type is only Vata. Only Vata. Okay? Shwas arises. I'm sorry. I think we are on the next page. Okay. Here you can see the breathlessness will start only after taking extra food. Are you getting my? Very simple. If the patient is eating beyond the capacity, his stomach will be full and there will be pressure on the diaphragm. A lot of food in the stomach and pressure on the diaphragm. Diaphragm is a main muscle of respiration. Diaphragm is a main muscle of respiration. So when there is a pressure on the diaphragm, naturally patient will get the breathlessness. Okay. So that is related with the extra taking of the food. Does not suffer much problem hota nahi usko. Eating, swallowing of solids. Then here you can say That sthana vaikunth is also negligible, and where very if you take a little bit rest and that food is digested, Shwas will go away. So Kshudra Shwas is not a serious problem. Okay, we will move further. Now the most important is, yes, Tamaka Shwasa. Just for your good feeling of the ear, I just would like to chant. Kindly excuse me. Don't take tension. Don't take tension. No. Pratilomam yada vayu srotansi pratipadyate grivam shirasya sangruyya shleshmanam samudirya cha. Can you see here? I am reading this. Karoti pinasam tena ruddho gurukam tatha ativa tivra vegam cha श्वासम प्राण प्रोपीडकम प्रत्यात्मति वेगाच्च कासते सन्निरुध्यते प्रमोहम कासमानश्च सगच्छति मुहुर्. Feeling interesting, no? Okay. So most important thing, pratiloma vayu is there. Then there is a shleshman, cough is secreting. Then penis, a lot of cough is here in the sinuses. Guru ka whizzing sound is there. Ativa tivra veg, 40, 50 per minute will be there. And most important is, I will tell you further. Here, we will go slowly up. You can take the screenshot if you want. Very interesting, very interesting. I will tell you. Here. Tasyaivachi vimokshante muhurtam labhate sukham. Okay? न चापि nidram labhate shayanaha shwasa piditaha. When the patient lie on the bed, breathlessness more. So always the asthmatic patient, they want to sit. They don't want to lie down, because after lying down on the bed, the problem increases. So they always sit like this and taking the table in front and like this. Okay. So shayanaha shwasa piditaha. Okay. Na chapi nidram labhate. But what? Asino labhate saukhyam. When they sit, saukhyam, happy, they are happy. Ushnam cha eva abhinandate. They want the hot water. Drinking hot tea, hot water. Fantastic, super. They are very happy. Sip by sip, sip by sip by sip. And externally also apply some oil and give the fermentation, hot water back. Very happy. Asthmatic patient, very happy. Okay. Then vishushkasya mushwaso mushcha eva dhamyate meghambushita pragvatai. When this attack increases, whenever there are clouds in the rainy season, then the attack is also more. Main word here is tamaka. Please write down. Tamaka means darkness. Whenever there is a severe attack, the patient gets like a black in front of his eyes. Tamaka is a dark. Tamaka is a dark. Write down this word. Okay. So the person is feeling something like he is going deep into some what is a dig. खड्डे में जा रहा है ना, ऐसा उसको लगता है उसको. Feeling like a fainting attack. Okay. We will go further. Now there are mainly important things I will tell you because time we have very short. One is a Vegavastha, when there is attack. Always in the Shwasa Vyadhi, this is a Yapya Vyadhi. Yapya means it is not 100% curable. Tamaka Shwas is a Yapya. Whenever the person is following the instructions about the Pathyapathya, what to eat, how to behave, which type of the Panchakarma he should follow, then only he gets the relief. But if anybody says, I can cure 100%, you will not have any asthmatic attack throughout his life, this is very, very wrong. He is a fraud doctor. He is a fraud Vaidya. He is a cheater. So don't believe on this. Bronchial asthma cannot be cured, but bronchial asthma can be controlled by Ayurveda. Bronchial asthma is definitely controlled by Ayurveda. You cannot get a frequent attacks, and the intensity of attack will also be less. So this is Vegavastha, when there is an attack. Okay. That we have already seen. Atibaddha, Sakashta, dyspnea will be there, sweating will be there. Then Avegavastha. The most important, why we should know the Avegavastha? Because in Avegavastha, when there is no attack, your lungs are always weak. So the treatment is given Rasayana treatment. Please write down. Why we should know avegavastha? That is called as a exacerbation and a remission. But when there is a good days, comparatively the patient is okay, at that time you should give best tonic for the lungs. Vardhamana Pippali Rasayan, Vardhamana Maricha Rasayan. I have already videos on the Ayurvedic treatment for different diseases. This is a big name of the playlist. Please check. Audios are there. Audios. Fantastic audios. And you can get the definite idea what is the importance of this avegavastha. Next is a upashaya. Patient is always better in a sitting position. Can you see here? I will mark for you. Upashaya means feeling better, feeling better. After sitting, he gets better. Then we settles down the gravity, Guru Guna. And then Vata Pradhanya, Ushna Guna is also temporary relief, Snehana and Svedana, which liquefy the cough. Liquefaction of the cough is there. Okay, eating the Ushna food items, the patient feel better. If he drinks cold drink, immediately attack will increase. When he will sit in the AC room, there will be attack. If he gets wet in the rainy season, he will get the attack. So remember, hot is better, cold is bad. Now we will go a little further. Yes, sadhya sadhyatva. Okay, Shwas Vyadhi is a yapya. Just now I have explained. So in avegavastha, can you see sthana vaigunya here? Rasayana treatment should be given. I am explaining all these things. Now there are subtypes of the tamaka shwas. You must remember these pratamaka and santamaka. Please write down subtypes of the tamaka shwas. Pratamaka and santamaka. When there is a pitta anubandha, normally it is vat kapha, but whenever there is a fever, infection is there, that is called as a pratamaka. When fever in the asthmatic patient due to infection is there, that is called as a pratamaka shwasa. Okay, and then whenever there is a psychological factor more, then that is called as a santamaka. Santamaka shwasa, when there is a psychological factors are more. Okay, then we will see the remaining few types. They are not much important. They are all emergencies. For example, there is a mahashwas, Shudra shwas, tamaka shwas, we finished. Mahashwasa is intensive care unit patients. Intensive care unit, ICU patient, mahashwas. Last. Patient is dying. All chest is congested, louder noise. The noise is so loud that the other patients or the doctors can hear from the netra are unstable. His eyes are becoming constricted pupil or dilated pupil. Drishti becomes vikruta and malamutra varod. He will have the problem with the constipation or the defecation problem, urination problem. He will be fainting. He will be unconscious more times. He may be in the coma. Okay, he may be on the ventilator. That is mahashwas. It is asadhya at the near of the time of the death. Now we will go. This is a rishta lakshana. According to Ayurveda, this is the arishta lakshana. Next is also serious, fatal. Urdhva. Can you see? Asadhya. Mahashwas, incurable, non-curable. Only palliative treatment, symptomatic treatment. On the ventilators. Mahashwas, Urdhva, Chinnashwas on the ventilator. Okay? Asadhya, prolonged expiration is there. Then patient is restless. Later there may be unconsciousness. Patient drowsy, in the coma, semi-consciousness, unconsciousness, and Chinna Shwas. Chinna is a breaking. That means first fast, then break, and then again slow, again fast, something like that. So Chinna is a abnormal in the frequency. Abnormal in the frequency. Shwas becomes rapid, often very slow, and often stops intermittently. Fast, slow, stop, fast, slow, stop. Fast, slow, stop. So this is irregular rhythm. That is chinna. Cut. Chinna. That is a breaking of the normal rhythm. That is called as a chinna shwas. The patient is having very weak ojaksha is there, severe pain, skin luster is lost. It is also asadhya. It is not very easy to treat. Okay. And now we are at the last point. Okay. Upadrava. The last point, just few minutes. Yeah, can you see? Just I will mark for you. These 3 points, you please write down. Please write down. Upadrava, complications. Udarka, that is the residual damage. After the disease has over, there is some damage to the organs. That is Udarka and Sadhya Sadhyatu, already we have discussed. What are the complications? I have already told you. Bronchial asthma is one of the chronic obstructive pulmonary disease, COPD, which affects the right ventricle, right atrium first, and there is a back pressure on the heart, and heart failure is there, or right ventricular hypertrophy is there, right ventricle failure is there, CCF will be there, congestive cardiac failure. Okay, Swarabhed, complications on the larynx, the patient will not be having because so much stress on all these parts, larynx and pharynx and all these things. That is Udarka. Afterwards, there may be emphysema, bronchiectasis, and cor pulmonale. It is affecting to the heart, cor pulmonale. Pulmon means lungs, and cor means affecting to the heart. So emphysema, bronchiectasis, and cor pulmonale. Of course, I agree. These are the modern terminology, but we have to take the support of even modern physiology and pathology to understand Ayurveda more better. That's why you will don't ask me, sir, emphysema word is in the charak? No, not at all. Not at all. So bronchiectasis? No, not at all. So the basic theme is of Ayurveda, but it is supplemented with some modern knowledge. That is my purpose of writing and explaining to you. Okay, my dear friends, I think this is very nice today's lecture about the very interesting Shwas Vyadhi, and we will discuss, of course, the treatment part. I have already the videos, but in the Kai Chikitsa subject in the last year, we can have a more enjoyment to understand this particular disease. Thank you very much. Take care, and we will see you tomorrow with some interesting part of the gynecology or the Prasuti Tantra or the Sri Roga. Thank you very much. All the best. Good night and take care.